Hello, everyone. Welcome to today's episode of Aesthetics and Wellness by Dr. Yusra. Today, I am delighted to introduce you to my superstar sister, Dr. Zainab Al-Mukhtar. We have spoken about all things behind the scenes, including women in business, including how we juggle it, being working mothers, feminism, working with your husband, and more. Enjoy. Welcome, everyone, to today's episode. On today's episode of Aesthetics and Wellness by Dr. Yusra, we have the superstar, Dr. Zainab, who's also my sister, my big sister, because everyone thinks that you look younger and is such a bugger. But anyway, welcome.
Thanks so much for having me on. I'm so excited.
This is excited to have you. So today we're talking all about us, our journey, how we're juggling life, work-life balance with the monkeys at home. And I say monkeys because we've been on half term. We have 5 of them at home at the moment, and it literally sounds like a jungle.
Yeah, literally. And I have to say, this was quite an impromptu decision, wasn't it? Just because I'm here in Liverpool, we thought we would make this happen today. So again, thanks for having me. There's so much that I want to talk to you about. But we've got half an hour? So yeah. Let's hone in on something that you think is going to be a benefit to people. One of the things that people often ask me about us is, how do you both do it? How do you both juggle this, what appears to be, and actually probably is, madness in terms of juggling work life, being in business, owning practices, being mothers, being speakers in our field, and educators and writers, and so on and so on. So I think this is the one to deep dive in. What do you say?
Absolutely. And I mean, you do it so well as well. And you own a practice in Northwest London in Harrow on the Hill with your husband. Practice used to be our mama's practice. And then you took over when you were pregnant. You bought the practice when you were pregnant with your second child. So tell me about how you manage that and that juggle and kind of converting it into your own.
Yeah, so I'd been working in that practice since 2013, so 11 years now. And at the beginning, of course, our mum owned it. And at the time, it was a dental and implant practice. It had no facial aesthetic platform within it at all. And it was branded as a dental implant practice. And I was building my list in that practice and did that for all these years. Around the 2018 mark, I noticed that I had really built a very busy list, and it had come as an option on the table. My mum, our mother, I keep saying my mum, our mum retired in 2016-ish and said, do you want to buy the practice? And at the time, I really wasn't particularly business minded. I've never really had an entrepreneurial mindset. And for me, my focus was very much the craft, the patients, the relationships, and so on that I had with patients. And I was really enjoying, the mastery of the craft itself. And so I said, not yet. But about 18 months later, I realized, our mother was very serious about selling. This is a place I'd already practically changed the niche of, and it'd be a shame to start all over again anywhere else. And I loved the location, and it made sense. And I bought it alongside Ahmed, my other half, my husband. We bought it end of 2018, and I didn't know I was pregnant yet, and then found out I was pregnant. So there we are. We bought this practice. We're rebranding. We're making some changes, yet still always I'm committed to keeping the quirks of our mum. She's amazing and should be always acknowledged, I think, as the founder of that practice. But there was a lot that we wanted to modernize and change and make it relevant to what we were both bringing to the table, which was this idea of having a practice that had a dual approach between aesthetic dentistry and facial aesthetics. And anyway, so I was pregnant that year. And during my pregnancy, this is the second child. I thought, I've got it all in hand. But what I didn't realize is the jump from 1 to 2 was massive. From one child to the second child was massive. And that brought up a whole new set of challenges, because of course then a year later, not even, we had COVID. Yeah. So in some way that was a blessing for us to all pause the madness. In another way, we took it as about a month into COVID as an opportunity to work hard on the rebrand, work hard on things that we couldn't do while we were working in the clinic. And so it was a busy lockdown, and there was a lot of transitions over the years. So we've had to find our feet through it all. But all in all, I've learned a lot, and the learning keeps going. So that's it in a nutshell.
So you bought it while you were pregnant. Then you had the baby. Did you take time off?
Yeah, for the first child, I took about 7 months off and weaned back into work 1 day a week and slowly building back up into working life. With the second child, it was very different because I had a huge amount of responsibility. I had patients who were waiting for me to come back. So I took a solid 3.5 to 4 months off.
Which is really...
You know, it's difficult to say I regret it because actually I can't think of how else I could have done it. But I wish it didn't have to have been that way, because I was then just juggling a lot with a child who's 3.5 years old, nearly 4, a very small baby, nursery drop-offs, a clinic that I was, suddenly running. And I remember having to take the little one to work. And I was, of course, nursing the child, nursed her for 2 years. So it was a lot. But as I said, I think that was probably the hardest time. So 2019 to 2022, actually, have been some of the hardest years in terms of just everything being fast-paced, a huge juggle, and me realizing that what I thought was possible was possible, but with a huge cost.
There's always an opportunity cost.
Yeah. And that slowly, I was losing myself in it all and not even realizing that. Just, it was survival mode, Yusra. And I know that you are familiar with this as well. And we both know that's not healthy, and we don't advocate that to our patients and nor to the rest of the world, and yet we were doing it to ourselves. And so from 2022 to now, I've had a little bit more of an awakening. I've really had to think, okay, I've seen the impact. My kids are really young. I need to make some shifts. And so my mindset has shifted a lot. And I'm moving away from survival mode to really, I want to enjoy being in the present. I want to make the most of every minute with them. And I also want to be really present when I'm at work. And we both know how hard it is when you're trying to do it all and you're trying to do it all at the same time. That does not work. Then you're not present here nor there. So now I'm a lot more able, I think, to compartmentalize. And yet, even now, I will say, I'm still on a journey. There are still massive challenges. Compartmentalizing it's so idealistic to say, sorted. It's not. The equilibrium, I think it's never totally that we're giving equal to both, parts of our life. I think the balance tips a little bit this way and that way, depending on where the dire need is at the time. And there are times where it's a little bit more of it seems like a seamless balance, but that's often quite short-lived before someone is ill and needs us, or something in the clinic happens and we're needed there more. So we've both, and I'm keen to hear from you as well, we've both found strategies to make this workable. And for me, they have been to really stop looking at the outside and start looking a bit more inside. So become a lot more introspective. I realized the value in literally sitting still and looking outside the window, something I was very bad at. And I still struggle with that. There is always this guilt of, I'm not being productive. There's a to-do list. I've got so much to do. Time is ticking. I've got 4 hours to get this done and then I've got to pick them up. There's always that. But I'm getting better at just sitting still. And in that time, answers come. So stillness, compartmentalizing, delegating, and more self-compassion and less attachment to perfectionism. I've thrown perfectionism right out the window. Something that I think many dentists have, and I know you have it too. Many dentists have this, and I think it's ingrained probably partly in childhood, but also in dental school. And what comes with that is we think we should be amazing at absolutely everything. And now I'm able to pick, actually, I need to use that trait when I'm treating someone's face, but I don't have to have my living room perfect all the time. So it's really about having more awareness. So that's it in a nutshell. So tell me your thoughts now, because as we all know, I can talk for England.
So loads to unpack there. And all really interesting and really relevant stuff. I remember when Mama first started the practice, I was doing Max Fax at the time.
Yeah.
And she is in a beautiful location here on the hill next to Harrow Boys School. And she called me and said, I found this beautiful building. and I want to start a private practice. And then she bought it and started it in 2010.
Yes.
And anyone that knows our mama knows she's like a superstar. And definitely, I mean, I know you and I are like two peas in the pod. We have very similar mindset. We share the womb. We think the same way, and sometimes scarily so.
Yeah, telepathy.
Big time. And we'll buy the same bags. We'll show up wearing the same dress, and we'll literally think in the same way.
Yeah.
Partly nurture, partly nature. But anyway, mama is our biggest inspiration for sure.
Yeah.
And I think looking at our mama, she's retired now, smart lady, and she's enjoying her life and painting and really delving into spirituality. And when she raised us as 4 young girls, she did the juggle, and we've used this word now a couple of times, juggle. And I want to talk about that because there's so many connotations to juggling. Like, are we actually really jugglers? But she did it phenomenally well, but she struggled as well. You know, our dad was a surgeon. He wasn't around that much because of the pressures of his job. I remember her coming to pick us up from school, running into the house, her handbag still on her shoulder, and start cooking. And it's only now, years later, that I have 3 children, I have a practice, I realize what she went through and how difficult that was. And I've heard from you as well, talking about juggling. We keep, this word of us juggling.
Yeah.
I mean, I love the suffragettes. The suffragettes are the people who made it possible for us women to do what we do today. They were feminists. They fought for women's rights, women to be able to work. And I speak for, I think, both of us. My job is not just a job to me. I love what I do. It's a form of therapy. It's art. It's meeting people, it's talking to people. I often joke, my assistant yesterday, we were having a chat to her. And she says, when I was doing Max Facts, my patients were obviously asleep. And now my patients are awake and I can talk for England with them. And we end up chatting a lot. But I really enjoy that part of meeting people and talking to them. So we joke that if my patients were asleep, I'd wake them up and be like, so, how are you today? And
it brings so much fulfillment. It's an extension of human beings need connection.
Totally.
And the patients need it.
Yeah.
And for us, it's a great opportunity to have that at work. I mean, what a huge blessing.
Totally.
We have that at home. We build that, nourish that in our relationships, family, social, but also we get to have that at work. And that's a massive part of what we do. So
we're lucky because we love what we do. Yes. And that's really, that we have to acknowledge our privilege. How wonderful is it to jump out of bed every day and enjoy every minute at work? Of course, there's going to be pressures and hard days, but generally speaking, we love what we do. And so our work is partly an enjoyment, a hobby, a passion, and that fuels us. And so, I sometimes think about this and I think, I love the suffragettes, like I said, but this whole thing of women doing it all. Can we do it all? And I have so much to say about this. I know you do too.
I think, and I'm thinking, can we do it on this one, on this particular podcast? Let's touch on it.
I think it's an important topic to talk about because often I get patients even message me, colleagues see me and they say, how do you do it all? And I feel like, hold on a minute. This, Instagram is a highlight reel. You're only seeing the highlights. Nobody sees the pains, the sores, the night sweats, the difficulties with the children, the hard work behind the scenes, the grafts, etc. And no one's sharing their failures and all those kind of the real painful grafting. But also I don't want to give the impression that whilst I do believe you can do it all, I don't believe you can do it all at the same time. And I think there is an opportunity cost. So when I'm at work, I'm not with my children. If I'm having a late night at work, that means I'm not tucking them into bed. And I really want to be honest about that. Yeah. You and I have spoken about being responsible about the messaging that we put on social media because last thing I would want is to set an unrealistic standard for anybody.
Exactly.
What's your thoughts on that?
I completely agree. And we've had so many conversations about this. I feel almost a bit heavy-hearted about it, actually, because we both have a following on social media. And I know that younger medical colleagues, dental colleagues are also aspiring to do this juggle, thinking that it's glamorous, thinking that it's the way forward. So then
did we get it right? Should we have just married rich men and stayed home all day?
No, I think we just need to be really honest. And I think social media can be a difficult platform to do that in. So let's do it here. Let's just do this where we just say, look, here is the cost.
Because this concept of juggling, we're not jugglers, right? So yes, sometimes our children come to work with us. We went to work with our mama sometimes,
Yeah.
But we're not jugglers. And actually, one of the last balls that you ever want to drop is the ball of your children, and also the ball of your work. So this concept of juggling.
Yeah, and the thing is that it's not just the physical juggle, it's the mental juggle. It's probably the bigger thing, because physically you can outsource support.
Yeah.
You can cut off your hours at a certain time and then be with the children.
Yeah.
You can do that.
Yeah.
But it's the mental load. It's the exhaustion. And then how much capacity do I have now at home? It's the headspace that business takes. And that's why I think, let's change the message. Let's say, look, yes, you can do all of this, but number one, you don't have to.
Yeah.
And number two, here's the cost.
Yeah.
It's that much harder to mother. And it's that much harder to mother really well. And let's just be honest. Let's own that.
Yeah.
So
who bears the cost? Do you think it's our children that bears the cost?
Well, I think what ends up happening is that we will give them everything, but we will be depleted. Yeah. So by the time it's bedtime, you're just done with the day. And the reality of business is that actually our day doesn't really end there. It didn't end at 3 p.m. when we picked them up.
No, it's 24/7.
That was just that we compartmentalized it. Yeah. We picked them up, we did dinner, we did homework, we put them to sleep. And actually now we've still got the stuff we didn't get done from 3 p.m. onwards. And beyond, because we're educators in the field, we're writing, we're course creating, we're all sorts. So, 9 p.m., the laptop comes out again. Now that is exhausting. And that is what I mean by the end of 2022. I realized that actually I'm becoming a bit of a depleted woman here. Yeah. And I can no longer give my best if this is not sustainable.
So is that it's kind of a burnout?
I think the name burnout, I'm never diagnosed. I never had an official diagnosis or sought that kind of help where I've said, look, am I burnt out? But I certainly saw the signs. Yeah. I was heading that way. I saw some of the red flags.
Talk to me about those signs.
Well, one of the signs, like you were saying, we are extremely passionate about what we do. I was beginning to feel that the exhaustion was removing some of the joy. And that was the scariest thing. So I was like, no, I love this. This is literally should never feel like work. Yeah. For the last... How long has it been now since I've qualified? 14 years. It never felt like work. And it was beginning to feel like work. And I thought, no, that's one sign. The other thing was just noticing that actually I'm not seeing my friends. I keep saying, I've got a deadline. And when you don't spend social time, there is a lack of connection in the world. Yes, we're there at work. We've got a family. We're connected with the kids. But you need that too, that balance, right? I was not watching Netflix, not watching movies. This lifestyle was the red flag in itself. Yeah. The lifestyle was the red flag.
You're not really living. You're exactly. Yeah. You're living to work.
Right.
You're not working to live.
And I would take holidays, but the holiday would be a holiday and then come back to it. So it wasn't a mindset shift, and that's what I needed. Yeah. I needed a lifestyle change. I needed a mindset shift. The mind is the driver and the engine of everything. And it's the mind. It's the driver of everything for me as a human, for my family, for my team at work, and for the whole business and the brand itself, and for my patients. So it's paramount. It is vital to go back and think, number one, am I okay? Is the trajectory healthy? If not, what am I going to do about it? So one of the big things, I'm going to just mention this, is a book that I think that everyone should read. Yeah. The Organized Mind by Daniel Levitin. Excellent. And I'm still about 2/3 in, and it's quite a heavy read, but there's a neuroscience chapter, and then there's basically how to organize your life.
So
and
give us a 2-minute summary of that.
I'm going to give you something that just spoke to me.
Okay.
In the first chapter and got me hooked, which is that our brain needs and has two brain states, essentially. Very simplified way of saying this: the mind wandering mode and the executive function mode. In executive function mode, our brain is thinking in a linear way. We're in task mode. We've got things to do. We've got deadlines. We're just thinking linear. And mind wandering mode is when you are not thinking about anything linear. You haven't got a task in mind. You're not working through to-do lists. You are just being. So you might be sitting on a train looking outside the window, looking at the field. You might be on a plane looking at clouds. You might be listening to raindrops. Whatever it is, that state of mind is called mind wandering mode.
And that's when you're in your creative state.
Right, because in that mind state, the neurons in your brain are firing without any limitation. So you've got different aspects of your brain interacting together. And this is the mindset in which you can be most creative, in which you develop empathy, in which you are able to create solutions for problems that previously felt unsolvable.
I love that.
The executive function mode is where I was living. Nonstop. Now, what this book told me, and I mean, it's so obvious and we're all raised to know this, but it's funny. It only really resonates when you realize that something speaks to you for a reason. You need to have a balance of both brain states, and you cannot be in both brain states at the same time. Therefore, we need to pave the way in our life that we have some time for executive function mode and some time for mind wandering mode. And it's so obvious, yes. But what I realized and how it spoke to me is because actually I realized I'm just living in executive function mode. And what happens when you live only in executive function mode is you cannot solve problems that previously felt unsolvable. You may lose empathy, and our job relies on empathy. And as mothers, we are relying on empathy. I mean, it's a massive part of who we are. Compassion is key as a human being. And that was a red flag. Oops, okay, I cannot afford for that to happen.
So then that leads to compassion fatigue.
Compassion fatigue.
Tough love.
Yeah. And then also your decision-making ability and your clarity of mind goes downhill. So there we are. Cognitive function is going down.
Yeah.
Your empathy is going down. Two things that we need. So I was like, right, this is actually make or break. I can see the trajectory. If this is what my mind state is in most of the time, this cannot be healthy. So I literally sat there and I made some decisions that I need to implement mind wandering mode in my life. How do I do that unapologetically? And I'm still figuring out the best ways. But a couple of things I did is I put my phone away and lose it on purpose in the house and not look for it for a while. Yeah. And that puts me in mind wandering mode. Difference. I'll sit with the kids and I'll daydream outside the window and wow, it's amazing. Yeah. When I'm driving, I'm in mind wandering mode. So I do more drives, in the country, in the areas that are quite green. I drive and walk around Harrow on the Hill in particular. I park my car in a very, very amazing spot on Harrow on the Hill after I do the drop off at 8 a.m. And I spend an hour just walking around before my first patient with a cup of coffee. I started piano lessons and that's just a half an hour in the week that just gets me into another mind state, where I'm learning something that is non-clinical and doesn't feel like anything to do with work. So I'm still...
And is that protected time?
Protected time.
Okay.
Yeah.
And so you do it every week?
I do it every week. So I have a lesson every single week. I found this teacher, she was teaching my daughter and I just thought, this is what I need. I need a bit of this. So I said, will you do adult lessons? She said, oh, absolutely. So there are little things. And there are still things. Well, I think what it opened my mind to is that there is so much more to life and we really need balance. And actually I will perform way better if I allow myself that. So answer to your question, can we juggle? I think yes, but there's only so far and you need to keep looking at what is going on in your mind and look for the red flags and really make changes.
Basically, you came to the point where you started to recognize these kind of traits or these red flags, as you say, and that's what instigated you to make these changes. And now you're trying to incorporate it into your life in a more systematic and sustainable way.
Yes, through habit stacking, through pausing, through reading. I undertook some coaching. So it's an ongoing journey and I absolutely love it. And I think this should be, I wish it was always like this. And why it wasn't an issue 4 or 5 years ago is because at that point it was one child. There wasn't a business. But the more hats, the more likely it is that I have to drop something. And so the other thing I did was that I stopped dentistry, which was a very difficult decision to make, but it was the right decision. I needed to focus on facial aesthetics, being an educator in the field and so on. It made absolute sense. My husband was big on dentistry. He's a legend in his field and he runs the dental aspect of the practice and I run the facial aesthetic aspect.
Yeah. Okay.
How about you? You have a few minutes and I really want to hear it.
What's the question?
Okay, so we've established we can do it all. Women are empowered, yes. However, there is a cost. Yes. We can do it, but we don't have to.
Yeah.
How is it that you do it? And how is it that you do it and still stay healthy? Mentally?
It's a great question. I think I have had phases in life and I've had many wake-up calls in life. One of them starting off when I had my autoimmune condition. And I've always been, I did Landmark, you've done Landmark. Landmark is a personal development program. And on that personal development program, I realized that my winning streak was my, in the way that I was independent. I don't, unfortunately, I love the fact that you have a partner and you can juggle and share the workload of running a business, because I find that very, very hard, is running 2 clinics, looking after all the patients, looking after my team, looking after my children. But really, I am the lead at work, and your business is only as good as the lead.
Right.
So if I'm not showing up as my best self, I'm really always aware of the impact that has on other people around me.
The buck falls at you, you know.
I'm like the ultimate responsibility.
Yes.
And there isn't a 9 to 5. There is a 24/7. Even when I'm off, I'm never off. I'm always on call. And that, I think, takes its toll. So now I have very protected time, and my team know that this is my protective time and only contact me if there's an emergency.
Right.
But when I was on this personal development program, I remember how I came to be how I am, which was a moment in time when I was about, I think, 9 years old.
Yeah.
I was in year 3. So what is that, 8, 9 years old?
Yeah.
And at that point, I came home from school, and our mama looked at my report card, and it wasn't what she expected. But she was so nice about it. And I said to her, Mama, I think that they mixed it up with someone else. And she went, oh, okay, is that what happened? And I said, yeah, it's not my report, it's mixed up. Because I felt ashamed, I felt embarrassed. And she said, that's fine. And we still went, and we still had our McDonald's or our treats. And we went home, and then Baba, God bless him, who is a Iraqi surgeon, and his mindset, of course, and I totally understand, had come from a mindset of, you need to be 100%. If you got 99%, why did you not get 100%? Yeah. So I came home, and my dad said, "Why? What do you mean you didn't? Why did you used to get this mark?" And I ran. I ran up the stairs. I hid in my room, and I heard my mom say, "Amir, leave her alone. She's going to fix this on her own."
And not that he would have told you off about it, but it's just that word. It's just knowing that it's the disapproval, and yet, I'm conscious not to blame, because as a parent now, I get it. We want the best for our kids, but in particular, that generation, the immigrant generation and high achievers our parents wanted that for us. And he would say something like that.
But it's great, because that became my winning streak. And I heard from that is, you need to fix this yourself. And that became when I became very independent. And I thought, okay, I took from that is, you have to fix this by yourself. And and that's what that's kind of what fueled my drive. And I didn't really realize that, but there's a cost with that. And I think because I consistently and continuously pushed myself, that had an impact eventually. And I think I was also quite an internalizer. There wasn't much, Mama had 4 kids. Yeah. You were the eldest. Yeah. You definitely speak for England. So there was less space to talk it out. Sure. And therefore I would hold a lot of it in. And what ended up happening is like a therapy session now. Yeah. What ended up happening was I internalized a lot of stress, but stress does something, right? Yes. And when you're talking about executive brain versus wandering brain, there is a hormonal impact there. When you are in your functioning mode, you are fight or flight, your cortisol is high, you are in task mode. Yeah. Whereas when you're in your creative mode, your wandering state, your hormones are more leveled, you're able to think laterally. But if you're in a constant state of cortisol, which ends up happening when you're juggling business, juggling work, juggling children, there is no space for anything else. So you're in a constant fight or flight mode. You're in elevated cortisol, and that has an impact on your neurodegeneratively, your cognitive function.
Absolutely.
It has an impact on your hormone levels. Yeah. And eventually that stress has an impact on me. And I developed an autoimmune condition. I think that was totally stress driven. And I'm really conscious of that.
The mind-body connection.
Exactly. And I went to a doctor at the time who told me to go and watch a documentary called The Connection, which was all about the mind-body connection. And I learned from there what to eat, what not to eat, how to reduce inflammation just in my diet, my lifestyle. And that's something that I'm now really conscious of. And that's something that I implement all the time. And there's another book that I'm reading called The Hidden Cost of Stress, When the Body Says No. And that's by Gabor Mate. Yes. I know we both love Gabor Mate. Yeah. He's just an incredible author. Yeah. And he talks about how so many people who develop autoimmune conditions are the ambitious women, and it tends to be more women than men. The ambitious women who are juggling too much really, trying to do it all and hold themselves to high standards. So no one is there telling us you need to show up to work today, or you need to do this, or you need to write that paper, or you need to, it's actually the voice in our own heads that's telling us to do that.
Yes.
And it's because we're holding ourselves to high standards and we're pushing ourselves.
Yes.
And so sometimes yes, we have a winning streak, but we can be our greatest enemies.
Absolutely.
And there is an opportunity cost, not just with the time that we have with our children, but on our own health.
Yes.
And as we move into the next phase of life, which for you and I will be the perimenopause, that becomes even more relevant because the stressed woman or the running around woman who can handle, who's survived thus far on heightened cortisol can't quite do that when the hormonal shift starts to happen. Brain fog starts to come in, fatigue starts to come in, overwhelm at work, all sorts because of hormonal imbalance. So this running around syndrome is not just unhealthy long-term, but also unsustainable. So when we talk about the juggle, I think it's important to acknowledge we're not jugglers. And actually, if you juggle too much, you end up dropping a ball. And so be active about knowing what balls you want to juggle or what you want to carry on your plate. And use the power of no. The power of no is
Boundaries.
Your own, absolutely, and using your own voice and being really aware of when something is too much, what you can say yes to and what you can't say yes to. Because the reality is you only have so many hours in a day. You only have so much, you can get decision fatigue. There's only so many decisions you can make in a day. So you've got to be really mindful about what you put on your plate. And if something is not aligned or is going to tip you off edge, or means that you're not going to be able to focus or give enough energy to the most important things on your plate, then actually leaning into the power of no and saying, actually, no, maybe not never, but no, not right now for this. And compartmentalize that so that you can show up as your best self for what you have on your plate, rather than being so depleted that you're just about surviving, you're not thriving.
Yeah. Oh, I couldn't agree more. Everything you've just said. I think there's a couple of things there. When you're saying no to something, I think we need to reframe the saying no into actually what I'm saying is yes to myself, or I'm saying yes to my children, or I'm saying yes to my health, or I'm saying yes to a project that does align with what I'm trying to achieve here. And I think this speaks to many women and men. And I think in particular, from what I'm observing, many healthcare professionals who have got this overachieving, high achieving, I'm going to call it syndrome. It's a great thing, but at a cost, right?
It's a winning streak, but there's a cost.
But there is a cost. And everyone's on their own journey, and people either realize or they don't realize, or they realize at some point when it gets too much. But you touched on something very, very key and is the crux of all of this. You can have this awareness. You can be aware, this is not ideal. I need to change this. This is not healthy. I need to do this. I need to do this. But many people struggle to manifest those things. Many people struggle to put those into action. They are driven by either the habit of achieving or a blind spot. You and I have done this landmark forum. I did mine in 2012, transformative. And I've since then done lots of similar courses with the landmark forum and other. And it's kind of peeled back all the layers. One of the layers you just mentioned was that experience, right? And the reason why you remember that is because of the emotional impact it had. And it drove you. There was a fear of failure.
Yes.
And that's fine. And many people will use that to an advantage of therefore succeeding. But if it remains a blind spot, you just keep going.
Without acknowledging, without seeing.
And you just keep going through all the walls and breaking all the walls ahead of you and not realizing until one day crash, right? So I think it's not that we're saying don't do it. I think it's really important that we're saying do it, but don't let there be a blind spot. Where is it coming from? We need to figure out, where is this drive coming from? Because once we figure it out or have some awareness of what is actually the why, what's really beneath that, only then can we have the power to make decisions about what to drop, what to keep. Okay.
I agree.
And therefore, I'm a big advocate for personal development. And I think there's long been a taboo over stuff like this, and it sounds woo-woo and people just don't bother.
No, it's vital.
But
because if you don't understand yourself, how can you understand others?
I mean, it's so powerful. So big advocate for it. And I think that anyone who's bearing huge responsibility has got to also take that responsibility to look within and think, what is driving me? What do I really want? What's aligning with me? But we need to do a little bit more digging and be quite introspective in order to be able to achieve those things.
I think another thing, if what it really comes down to, the crux of it is, I remember being on a podcast and somebody asked me, so what's your secret sauce? And I said, secret sauce for what? And I said, for your success. And I thought about that, and I thought, well, I don't actually sit there and go, I'm successful. And I think that's because I don't define success as an amount, a turnover, or a set amount of objective measures. And I think redefining success is very important because, again, we spoke about this as well. I am conscious now of the messaging that I'm giving out on my social media and in other areas to women. I'm all about empowering women. And I absolutely think, you know what, if you love what you do, whether that is not working or working, whether that is being a stay-at-home mom or being a working mom, whatever is right for you. And each individual will be fueled by their own interests, their own loves, their own passion. One of my best friends is a stay-at-home mom, and she absolutely, that is where she's thriving. Yep. And I am so inspired by her because I think the girl got it right. Right? Yeah. And actually, I'm kidding myself maybe. So it's redefining success is, I think, a really important thing because so many people come and they say to me, "You're everywhere and you do this and you do that. And how do you do it all?" And I think, whoa. Yeah. First of all, okay, let's redefine success and let's be really open about our opportunity cost. And I've spoken about this a lot. I'm really clear, and I don't hide the fact that when I'm in London, it means I'm away from my children. When I'm at work late, it means I'm not taking it into bed. There is an opportunity cost, so you need to be aware of that and choose your cost for any opportunity you say yes to. Yeah. And then, what does success look like to you? And now, for me, success is having more balance, actually being present, being in the now. Yeah. And so, for a long time, I switched my phone on silent. Yeah. At night, I don't look at it. It's not the first thing that I look at in the morning either. And I'm really conscious about that decision. It's a conscious decision to almost disembark from this rat race, because if that's the first thing that you look at and you're allowing that to enter into your mindset, you're immediately in that zone. So I don't look at it first thing. And then often people are angry at me because I have 117 unanswered messages. But I have to consciously say no to that because I'm saying yes to being with my children. I'm saying yes to living more. Yeah. And so success to me now is certainly living more, having balance, going to Pilates, learning how to ski.
At 8:30 in the morning.
At 8:30 in the morning, like today, tried to wake you up, but that was a whole other story. Learning a new skill, you're learning piano, I'm learning skiing. That to me is now bringing me a lot more joy. And I didn't make space for that before.
And I think especially in healthcare, we are pouring all our love into it.
It's a giving.
You can't pour from an empty cup. Yeah. Finally, actually made sense. I'm like,
that's what it
gotta
means.
Fill my cup means literally filling my cup. Yeah. It means literally carving out the time. I just want to touch on something you said. I think number one, I completely agree with you. Yeah. Redefining success. And I think, I feel like we're on this joint mission to relay this message, I think, to the women who do look up to us or who ask us these questions. I really want to put that message out. So thank you.
Tell me how you define success.
I'll do that. And then I also want to touch on what you said about social media in the morning. It's a massive thing. I think for me right now, success, literally, if I have to oversimplify it, success equals balance. Yeah. And balance means really emotional, spiritual, physical well-being, connectedness with the important people around me. Yeah. It's success in relationships. Yeah. First, the closest relationships, and then slowly outwards. That for me is more, more of an achievement than anything to do with, as you were saying, targets. And I've never had that mindset. In fact, I remember having a new manager a couple of years ago. She was amazing. And she sat with me and she's like, this you need to do. And I was like, And she said, don't you want to make more money? And I was like, it just doesn't sit with me. Yeah. And that's never really been my why ever. And I think actually that's probably why organically we've been successful, because that was never a part of the main goal. Yeah. And it's palpable when this is, right? So our patients just get that we really value the relationships and looking after them. Anyway, so going back to what is success, it is balance. Yeah. It is really being in the present. Yeah. And it is carving out time for me to continue developing personally as well as professionally, not just one or the other. Yeah. I want to touch on what you said about
social media in the morning.
Again, from this particular book, and it's just one of many personal development books that I love, but this particular one, it's just amazing.
So this one is The Organized Mind.
Yes, and I love it because it's really backed by science. There's a lot of neuroscience in there. It talked about the fact that we all in our brain have something called an attentional switch, right? And we have an attentional filter. What this means is that everything that comes into our mind, we are making a subconscious decision. Do I want to give this attention?
Yeah.
Is this important? Constantly throughout the day, we're doing that.
Yeah.
And that's the attentional switch and attentional filter in action. And the attentional switch means that we're going from one task to the other, or putting our attention from one thing to the other. Now, take that concept and now think about social media. When you open it and you are bombarded by this feed that comes up, lots of different videos, TikTok, whatever social media platform you use, loads of different videos come up. You are constantly making a subconscious decision. Is this one I want to watch? No, flick, that I do. Okay, like, next. All of those are decisions. Now, the other distinction that comes up in this chapter was that we all have got a decision capacity in a day.
Yeah.
And once we go past that decision capacity in a day, we get decision fatigue. We just cannot make, lose clarity, cannot make good decisions for the rest of the day. Apparently, now we are in this really bad situation, epidemic of people who are using social media first thing in the morning and throughout the morning, such that by the time they get to midday, they're at decision fatigue.
Oh my goodness.
How scary is that?
That's really scary.
So that's massive. And I think,
why? Because you're deciding what you're watching, what you're consuming.
What you're watching, deciding what you're consuming, what you're going to like, what you're going to comment on, what you might want to post. It's constantly, your brain is in overdrive, the attentional switch is in overdrive, the attentional filter is in overdrive.
This is why the owner of Microsoft, what's his name? And Steve Jobs and the owner of Microsoft, I've forgotten his name. Do you remember his name? Bill Gates. Bill Gates.
Oh, yeah.
Bill Gates is it. So Bill Gates always, and Steve Jobs always used to wear black. They would have the same outfit every single day. And, I'm sure it was new and pressed and so on, but they would always wear the same thing. So it's one less decision that they have to make. Therefore, they have one extra decision they can make in their jobs. So decision fatigue is a real thing.
Yes. And when it comes to, the organized mind again, one of the things that if you look at the habits of very successful people in the workplace, let's say, or whatever, it is this. It is the fact that they've minimized the amount of decisions they have to make in a day. Same breakfast, same outfit, same path to work, same radio station, whatever it might be. And they've left then room to make decisions about the important things. And therein comes the importance of routine.
Yeah.
So, and habit stacking and so on, and just staying consistent with certain things in our lives day to day.
Yeah, I love that. Okay, 2 questions that we have literally 60 seconds to answer now, right?
Okay.
So fire.
Okay.
No pressure.
The pressure is on.
Question number 1. You have obviously done such an amazing job at Harrow. You've kept a little bit of mama traits and some of the, the real warmth that mama brought to that clinic.
Yes.
But you've put your own touch on it. And you and Ahmed have done this cohesively together. You built it together. What is it like running a practice with your husband? Should I rope my husband in? Or do you want to kill him? What is it like? Be real, be honest, be raw.
I have to say, we work really well together.
Yeah.
This is one space in our life where we have designated really clear roles right from the beginning and stuck to them.
Yeah.
And we recognized whose strengths are what and whose weaknesses are what, and decided that, how to delegate the roles. And so if something comes up off the cuff, immediately we know who's best placed to deal with that. So from the point of view of who's doing what, it's quite easy.
So what do you do? What does he do? You've got clear demarcated roles in running the business.
Yeah. So anything to do with, conversations with staff, writing letters that require embellishment, I will do.
Yeah.
Anything that requires more difficult conversation, compassionate conversation, usually I will do. Marketing, creativity, my brain is bursting with ideas all the time. Branding, my mind is bursting with ideas. Yeah. The next thing to introduce, looking at the best devices to bring in. I'm always kind of thinking forward.
Yeah. So you're the marketing creative and chats with the stuff.
Yeah, and make things happen in that sense.
Yeah.
Ahmed is, I multitask quite a lot. This is one of my strengths, although I'm trying to minimize that now.
And Ahmed can't.
And I do interviews for, when I'm recruiting and things like that. So now Ahmed is much more of a diligent worker on one thing, focused on one thing, wants to master that particular thing. So he's he works more days than me now. So I've cut back to 3 days a week. He works 4 days. He's more willing to do more clinical sessions while I take control of certain other things. He's very good with anything to do with money and accounts.
Okay.
He's very, very careful and calculated. I can be a little bit more spontaneous. So he paces me and, we have conversations, and he's much more analytical about things. And I will think more about the bigger picture.
Okay. So you're creative CEO, he's financial CEO.
You might want to say that. Okay. I think the biggest challenge is time management.
Yeah.
I think we've become a lot better, but in the first few years, we were not as good at defining the boundary of when we will talk about business in the clinic. So there was so much all the time to deal with that it would, of course, trickle into home life. And, and that certainly happened during lockdown. So I had to literally, I noticed it, and I just said, we can't talk about this in front of the children. It's, diluting things. Let's define. And actually now what we do is I send him emails and literally treat him like a colleague when it comes to anything to do with work, and set meetings to talk about different things. So again, comes back to compartmentalizing.
That's amazing.
It really, if I have to summarize, compartmentalizing is key. Okay. And not taking home stuff into work, not taking work stuff into the home as much as we can.
Okay. That's really good advice. Okay. So would you advocate working with your husband?
Yes, as long as your overall vision is the same. And I think one of the other things is that we don't work in the same room all the time. We're in different rooms. And so that's helpful. You don't want to be together all the time and fatigue that. So I think it depends on which field we're talking about. In healthcare, I think it absolutely can work if you're working in different rooms and you've made agreements on how you're going to go about things and respect those boundaries.
Amazing. Okay. Last question. We're going to divide this into 2 parts. What would you say to your younger self? And what would you say to me as my younger self?
Wow. I love that. Okay. Actually, this might be the same message.
Okay. That's fine too.
So I think I would say to myself, cut yourself some slack. It's going to be okay in the end. And if it's not okay, it's not the end. And let go of perfectionism. There's no such thing. And along those lines, I would have just said, take it easy. Things work themselves out. Pause. You're doing great. I think I've always had a very harsh inner critic. So I would have been a bit more consoling and self-compassionate, to my younger self is probably what it would be. And I would say the same to you, because I think it's the same for you.
I love that. Thank you so much. Thank you for joining.
Thanks so much for having me. This was fun. Part 1 of many.
Part 1 of many. Done.